Are you an IEN looking to practice in Ontario? Welcome to SPEP, your gateway to becoming an RN or RPN in Canada. CNO has created SPEP to help the IENs demonstrate their nursing skills in clinical setting. Eligibility is that you must have met all other registration requirements other than language proficiency, evidence of practice, and transition to practice. You will be matched with an organization like hospital or long-term care facility where you will be working with the preceptor in real time. Well, there are different ways like Indeed, LinkedIn, and connecting through websites. And if you get the HR's emails, describe your scenario and personally mail it to them, your resume and eligibility of SPP program. Try connecting with people on LinkedIn who have a similar experience of yours and they do help out. Here are a few tips for your interviews for SPP. Generally, the interview starts with a good introduction about why you chose nursing as a career to warm up in the beginning. Describe your story when you graduated, which all clinical settings you worked at, your roles and responsibility, how you transitioned to Canada, about COVID maybe, and NCLEX RN, how did you clear it, and about transition to practice course. Usually hospitals have a vision of family-centered care and global care. So the usual question asked is describe a situation where you had provided a family-centered care. For example, that there was a time when I was providing care to a patient who was a small kid of maybe 1 or 2 years with hepatitis. He was crying and going through a lot of pain. They had been in the hospital for more than 2 months. I was caring for that patient and noticed that the parents were sad and ensured that they talked to me, and just to soothe that atmosphere we played some lullabies, and that could be an example of family-centered care. Try journaling your stories of what you have experienced during your clinicals. Coming to clinical scenario questions, always remember to answer in the SBAR format. Usually, a set of vitals are given and asked about what could be the possible scenario. For example, if they have given a breathing problem, you could answer like, I would check on the patient's orientation, check vital signs, call the respiratory therapist and the rapid response. Check for any kinks in the oxygen. If in my hands, I would titrate the oxygen to 6 liters or on a non-breather mask, and possibly try to figure out why it's causing such a thing, maybe a pulmonary embolism, or why same amount oxygen is not helping them, assuming that they don't have any COPD. Calling the doctor and telling the current status, the current oxygen saturation, asking him if a ABG or chest x-ray imaging for him, or a CBC for any infection, or a D-dimer test, something like that you could answer. Always try to answer your clinical scenarios like calling for help and staying at the bedside. Inform the charge nurse if it's not in your hands. Assessing the patients, always use vitals, orientation, maybe a neuro check or a blood sugar test, whatever is there in your hands. Performing an appropriate intervention and then calling the doctor for checking the if you need to get a EKG or chest x-ray or an abdominal x-ray, or if possible medication side effects. The common questions are also usually asked about the respiratory assessments, cardiovascular assessments. So try watching videos before your interview, maybe NCLEX SARA about assessments in general, what will you do, and about hypoglycemic events. Even some of the questions which are asked are describe about your mistake when you made feedback from your coworker, conflict with your coworker, about difficult patient you had to handle. But they really didn't ask me all of it. They gave me different scenarios regarding it. The interview is usually about for half an hour to 40 minutes. Try mentioning your strengths whenever you get the opportunity, that you are a compassionate person, you have good communication skills, that if you are unsure of something, I always ask questions to my seniors. Describe that how you are a good team player, that you are a reliable person, or open to feedback and communications. And even about that you are mentally strong, that you are mentally resilient. About your weakness, if they ask like that you're working on it and that you have limited experience, because it's natural, because you're new to the profession and you are engaging in as much as learning opportunities, like you have recently completed your transition to practice course maybe. In the end of the interview, always try asking your questions to the interviewer, like what would your advice be to me as a new graduate nurse? Could you tell about what you see the new grad struggling with and what's been helpful for them? Or in which part of the interview did you feel were my weaker answers? Could you guide me through it? Build confidence. Try to say to yourself that it's not your English skills they are interviewing, your nursing skills, and be positive. And in the introduction, always kind of to warm up the situation, you could describe what led you to nursing. Maybe your own, like you fell sick or you're taking care of someone in your family, which made you take nursing as a graduation course. Before starting, you will be given an orientation and set your learning goals with guidance of your team. And then you will be receiving certificate from your preceptor. After completing the program, your preceptor will submit a final assessment to CNO. You've got this. You are in your right path to become a licensed nurse in Ontario. Have a great day. And thanks for watching my video, and you can always comment in the comment section. And if you have any doubts, you can email me on csci1999@gmail.com.